Hello, everybody. This is Marilyn Francis, and I am the project director for the Patient-Centered Primary Care Collaborative. And thank you so much for joining our webinar today. It is about the new partnership for parent-to-parent transforming clinical practice initiative. Do I have control of the slides? I just want to introduce the people who will be talking to you today. As I said, my name is Marilyn Francis, and I'm with the Patient-Centered Primary Care Collaborative. And of course, you know Kathy Brill, who's the Executive Director of Parent to Parent. Kathy, did you want to say a few words?
Yes, thank you, Marilyn. I would just like to welcome everybody, and just as a reminder, and we're going to say it again at the end, that this will be archived on our members-only section of the website, so that we can continue these discussions and view this event at any time. I'm really excited to be able to consider the types of partnerships and the way in which we can connect with the Patient-Centered Primary Care Collaborative and the Institute for Patient and Family-Centered Care. I know a lot of you at the Leadership Institute, well, I know we don't have a whole lot on the call, but at the Leadership Institute, we had a lot of interest from our leaders for this type of collaboration. So I am very excited to have this opportunity to move forward on this with you, and I thank you for reaching out to us. And I'm glad that you all made it back from Leadership Institute safely. So thank you, Marilyn.
Okay. And I also want to introduce Mary Minetti, who's a Senior Policy and Program Specialist at the Institute for Patient and Family-Centered Care. She'll be the one that's going to be providing the background and instructions on understanding the model for the TCPI and the as I say, the Transforming Clinical Practice Initiative, but especially the patient-family engagement piece. We're really excited to have Mary be able to join us and provide us with all her expertise. So, Mary?
Thank you, Marilyn. Welcome, everyone. I'm so glad that you're able to join us either in person, virtually, or through the recording. We're very excited for the partnership with Parent to Parent and connecting you with practices and organizations that are trying to transform healthcare in the ambulatory and primary care setting. Just a couple words about me. I joined healthcare about 25 years ago as a quality improvement professional. And the thing that I've enjoyed most in my career is bringing patients and families into conversations to improve healthcare. Your lived experience and your perspective and your willingness to roll up your sleeves and help and make things better for everybody is just inspiring. And so I'm excited about this partnership and look forward to continued conversation with you about how to make this really dynamic and useful, meaningful to you, as well as to the practices and clinicians and others in the communities where you live. So thank you. Marilyn?
Okay, great. Okay, thank you. And I also, before we start on the program, I just wanted to also thank Jacinta Smith, who is one of my colleagues here at PCPCC. She's handling the technical piece of it, and so thank you very much, Jacinta. The one thing that Kathy had said earlier is that the webinar will be available on our site as well, so that people can go back and re-listen to what they've heard, or people who unfortunately couldn't join us today will be able to listen to it. I also wanted to say that during our conversation and presentation, please feel free to use the chat box to ask questions or to share thoughts that you might have as we move through the presentation. Okay? All right, so let's get started. So the objective today is to learn about the Transforming Clinical Practice Initiative and the Patient-Centered Primary Care Collaborative Support and Alignment Network, all of which we'll define here. We want to explore the person and family engagement strategies for accelerating positive change in how healthcare works. And we also want you to participate in the conversation with your peers about how to leverage your skills for making a positive difference in the TCPI program. And we also want to help identify what support you might need and others would need to be most effective as you move on in this program. So, okay, let's just start with some of the an overview of some of the goals for the TCPI. First of all, we want to support about 140,000 clinicians in their practice transformation, and these are clinicians who are obviously at the front lines taking care of patients every day. And we want to improve health outcomes, obviously, across Medicare, Medicaid, and commercial insurances. One of the things is that we want to reduce unnecessary hospitalizations and also reducing unnecessary testing and procedures that add a cost to the health care that is not of benefit, and obviously it's not benefit to the health and well-being of patients. And so by really focusing on practices and how to reduce these unnecessary hospitalizations or testing and things, we could really have a savings that, as you can see, $1 to $4 billion that obviously could go into other programs that are prevention-oriented or supporting patients who might have chronic illnesses. And so, and one of the other things with this, which is very important, is to really, as we move through this program, to build that evidence base for practice transformation so that it can be scaled to other practices. In other words, that we don't want it just to stay in a small section. We want it to be able to go nationwide and that people will adopt it because there is that evidence that good results come from these practices. And so the aims of the TCPI model is obviously to transform practice. We get the clinicians to achieve this practice transformation, which in part is based on, and very important part is that patient-family engagement for shared decision making. We want to make sure that it's all high performance and that we want to make sure that we have a significant improvement of health outcomes for patients in Medicare, Medicaid, and CHIP, and in commercial insurances as well. And we want to reduce the unnecessary utilization, like hospitalizations or overutilization of services that really add no value or do not help the overall health of the beneficiary. And as I had said a little bit earlier, we want to have these evidence-based practices that can be scaled or would be adopted by other practices who might not be initially in the program, but they see because of the outcomes and how people were able to push forward these practices that they would adopt them. And so we get that spread, which will eventually generate those savings. As we're getting that high value health care at the reasonable cost, you're able to make those savings and reduce those costs to Medicare, Medicaid, and CHIP expenditures. And overall, then there's the value. We want to be value-based. We want to make sure that we're paying for quality and appropriate care. And as some of you might know, we do have Medicare and Medicaid do have these incentive programs and practice models that reward value, which means good outcomes at lower costs. So the practice transformation in action. So how does this work? Well, as you can see, it's a three-pronged approach. We have the federal and state programs, which support the resources for the TCPI program. And then we have the practice transformation networks, and those are like health systems, large practices, and they help support those individual physicians or smaller practices in primary and specialty care practices. And then we have the support and alignment networks for achieving alignment with medical education and maintenance of certification. And PCPCP is one of those support and alignment networks that we call SANS. And as you see, the practice transformation networks and the SANS as I said earlier, they go into those individual practices, those who are really on the front lines, like your communities, the ambulatory and post-acute care services, public health, things like that. So it's really a pipeline of making sure that information is really going from a larger scale down to the primary care and the individual practitioners. And as you can see by this map, we do have the PTNs that practice transformation networks in almost all the 50 states. I won't go through them all. And then these are a list of our PTNs that, as I say, go across the country and from north to south as well, and east and west, as I had just said. So the key accountabilities of the PTNs, you want to achieve that quantitative aims. All those aims, we want to make sure that we're able to assess them and find out, identify which ones are truly valid and which ones are truly making a change for good and for the better in healthcare. We also, the PTNs are recruiting those clinicians and practices to make sure we build strategic partnerships. The PTNs also lead these practices in continuous improvement and culture change. As I said, you know, we're looking at the front lines, those frontline physicians and clinicians, nurse practitioners, other types of clinicians, to help them with that improvement and culture change. And we want to facilitate, the PTNs want to facilitate the improved clinical practice management, as well as utilize the quality measures and data that can really inform how, if they're achieving those improvement goals and what may need to be improved more, or what kind of adjustments they may need to do in order, in their improvement strategies to make sure they achieve their goals. And so the support and alignment networks, they tend to be a lot of the healthcare associations and other nonprofits, and Patient-Centered Primary Care Collaborative is one of the SANs, as they call them, support and alignment networks. And as you can see, there's several others that are in the SAN network. And so similar to the PTNs, we want to make sure that we have quantitative information to see how well we're doing in terms of advancing our initiative and achieving the goals that we've set for improvement. And our main accountability is the supportive practices, especially with the patient, person and family engagement ideal. And so, and we do that through, you know, continuing medical education, we do registries, we do newsletters, just to make sure that there's a constant conversation with the PTNs and others involved to make sure that we're moving forward in this initiative. And so that's kind of the basic outline of what the TCPI and the different aspects of the support and alignment networks and the practice transformation networks and how they come together to move us forward in this patient caregiver and community engagement. And so with that, if people have any questions, you know, please feel free to put them in the chat box or ask them now. But I'm going to pass it on to Mary, who will get more into the details of it.
Great.
Thank you, Mary.
Thanks, Marilyn. So Marilyn's done a really nice job of kind of describing for you the goals and the infrastructure that is in place to support patients and families and clinicians and their care teams on the ground in transforming healthcare to reduce costs and improve quality and improve the patient experience. So the Institute for Patient and Family-Centered Care has been around for 25 years, and we're all about creating partnerships, meaningful, authentic partnerships with patients and families and the communities with healthcare professionals. And so I want to just kind of set the stage for the work that we are doing. So there are a variety of resources that are out on our website. And one of the things that I just want to bring to your attention is that as we move forward in this collaboration with parent to parent, we may find it useful, and you'll really drive that we create a community of learning together. And if we were to do that, we would do it on our PFCC Connect kind of social networking platform. But I want to make sure that we're all on the same page about about person and family engagement. So patient engagement has been seen as kind of since 2013 as the blockbuster drug to help accelerate improvement in healthcare. But up until that time, there wasn't a shared definition of what engagement meant. And in some people's minds, it meant that the patient and family was compliant with what the treatment plan was that the clinician identified, that may or may not have been integrating the patient's values and family values and things. So with this Health Affairs article, they really began to define engagement as an active partnership between individuals, families, and healthcare professionals. And it's upon this definition that we at the PCPCC SAN in part and IPFCC partnering with them have built the work that we've been doing with the PTNs and the SANs. So there are two levels of patient and family engagement that we're working on. One is, what is the direct care level? How are we creating and moving healthcare toward creating a real partnership and shared leadership model with patients and families and clinicians, so that we really, on that right-hand side of this slide, really co-create care plans that do reflect the values, preferences, cultural beliefs, and goals and wishes and the outcomes that are important to the patient and their families. And so that's kind of true north. The other way that we believe we need to engage and invite patients and families to actively participate is in design and governance of practices. And true north would be that true partnership and shared leadership, that patients and families of that practice in partnership with clinicians together co-lead changes that are mutual, not just to patients and families, but also to those who deliver the care. It needs to be mutually beneficial. And there are lots of things that affect engagement, but that really is what we're trying to achieve, is we're trying to achieve opportunities for those partnerships to be created. Now, TCPI is measuring lots of things. They're measuring costs, they're measuring quality. If a person has diabetes, are there diabetes measures and controls so that they have better health and potentially better outcomes? But the other thing that we are measuring in the TCPI project is person and family engagement performance metrics. Now, you're going to see person and family, patient and family, it's all basically the same. CMS, who's the funding organization, the government funding organization for this project, likes to refer to it as person and family engagement because they have beneficiaries, and so they're not necessarily always within the context of patients. But in this project, we identified, and PCPCC SAN was very involved in this, in identifying what are important metrics that we're going to watch and gauge and encourage practices to implement that are reflections that they really are moving toward a shared partnership model with patients and family. And they're in three areas: governance, point of care, and policies and procedures. And so I'm going to go over those metrics really quickly for you, and for one reason, and this is what I want you to be thinking about as we're going through it. As we look at parent-to-parent collaborating on the ground in clinics or with the practice transformation networks, we want you to be thinking about how can you help support practices in moving toward really adopting person and family engagement ways of providing service that really support patients and families. So it's important for you to kind of understand what these metrics are. But more importantly, as you're listening to me talk about it, be thinking about, well, in your own experience as parents or as patients when you receive care, when have you seen these kinds of procedures and policies and ways of collaborating in place, and how might you, with your lived experience, help accelerate that and be a resource to those practices. So governance is all about how has the practice really invited patients and families to meaningfully give feedback and participate in practice changes. And so one of the things that we ask all the TCPI practices to look at is, do they have policies and procedures and ways, actions that they take so that they're really supporting patient and family participation in governance or operational decision making. And that can be that they have patient advisors integrated into quality improvement projects. So if they're going to improve care to kids, they might have parents, and if they're teenagers, adolescents involved in those kinds of decisions through patient and family advisory councils or being on the board. And the metrics intent is really that the practice is including the perspective and voice and lived experience of patients and families, because we believe, and evidence shows, that when patient and family voices are involved, then the solutions often are less costly, but more effective in creating those partnerships. A second metric that we are tracking in the TCPI project that we are trying to support practices in adopting is the practice really supporting shared decision making. And they can do it a variety of ways, but generally it has to start with training the clinical teams to integrate patient-identified goals, preferences, and outcomes based on what's important to the patient and family. And this really, the intent of this metric really is to recognize that the patient and family, however the patient defines family, can be by blood relationship or can be by emotional bonds, but that they're part of the care team. They're not just objects that the clinic does things to or for, but they really do things with the patient and family. So how can we support patients and families in shared decision making and inviting them into that process? The second or the third metric really is around what is the practice doing to increase the patient's and family's activation level. And activation is three things all kind of rolled together. One is it's the person's knowledge, their skills, and their confidence in managing his or her own health and care. And so does the practice utilize a tool to assess and measure patient activation? Because if you don't know where somebody's at, how confident they are, what knowledge they have, what skills they already have, how can you build on those strengths? And if you don't understand where there might be some gaps, how can you support them in being fully a member of the care team? So activation is an important concept to look at. The other metric is e-tool use. How does the practice create opportunities bidirectionally, back and forth, to continue to share information and interact with the patient and family when the patient and family are not in the office practice? And so many practices have already adopted this measure, and they have patient portals. But for some practices, they might have a portal, but it's very not utilized well. And so how might collaborations with active patient and family members increase the utilization of this tool so that people have access to their medical record? They have another way besides coming to an office visit to communicate with providers and care team members. And then what we know about care is that health literacy is really important, and that our healthcare system is very complex. It's hard to navigate. They use words and terminology that sometimes is not very plain language and is not easily understood. And so one of the metrics that we're tracking in TCPI is how is the practice dealing with health literacy? Do they have some way of knowing on an individual patient level and across their patient populations that the patients and families really understand and can act on the information shared? And it's not so much to focus on what are the gaps that the patient has, but rather what are the skills and knowledge and ability of the practice to really take very complex information and provide it in ways, not just with pieces of paper, but with words, with diagrams, with other ways, the information that's useful to people so that they can make decisions about their health care, but they also know what kind of actions they need to take in order to promote their health. And so health literacy is an important one. And there's lots of reasons why that is. Studies show that 40 to 80% of us leave our appointments with doctors and don't retain the information, or we retain it incorrectly because we have pieces of it. And what we know is that if we create decision aids, and if patients and families help us develop educational materials, we often do a better job, and that ability to retain information and understand it, to act on it, can be increased. And the final metric really is around, does the clinical team related to medication management, because there's so much use of medication as one of the treatment plans for people, how is the clinical team working with the patient and family to support their management of medications? Because ultimately, 24/7, 365 days a week, patients and their family members are managing those medications, and how is the clinical team supporting that? And that's all about safety, and it's about efficacy, and it's about making sure that the burden treatment of having so many medications that they're difficult to manage is reduced by really working in partnership with patients and families. So those are the 6 metrics. And they're metrics that there are other metrics that we could be measuring around person and family engagement, but these were identified by patients and families across the country, as well as clinicians early in this project, as being markers that if practices were working on these kinds of things, shared decision-making, e-tool, medication management support, understanding health literacy, involving patients and families in improving care through Patient and Family Advisory Council, all of these things together can really solidify and accelerate the partnership between patients and families and their caregivers. So, and collaborative medication management, there's always data, and so this is some data around why that medication management support is so important. And really, TCPI is about reducing harm and improving safety and improving quality. And so we were very thoughtful as we picked the measures, that they were all steeped, as Marilyn said earlier, in evidence. We want to choose metrics that have evidence behind them, that if we provide support to patients and families and really integrate them as members of their care team, then we can reduce that unnecessary patient harm and cost. So we're going to kind of shift gears now, and it's an opportunity for us all together to really have a conversation with you, the mentors, the parent-to-parent folks, to really begin to think about what has been your role in the healthcare system in supporting patients and families. And as you think about this project, this effort, this initiative across the country to improve safety, how can peer mentors assist practices in the PTNs in supporting patient and family engagement? So we're going to open up the phone line so that everybody can talk. Some of you may not be in a place where you can talk. I know there's at least one person who's at work listening in, so it may be that you want to chat in your thoughts about how peer mentors can assist practices in supporting patient and family engagement. But this really is an opportunity for us to talk together because we don't have, we haven't decided this for you. We want to collaborate with you. You bring lived experience, you bring expertise, you bring expertise in working with other parents who are dealing with healthcare challenges and issues with their children. And we want to know from you, what are some ways that you think you can assist the TCPI project and provide valuable input and support?
Did you open the line up?
All lines are open.
so people can chat. And Kathy, maybe you know some of the people on the line, and maybe you can kind of seed the conversation in terms of what's one way you think, Kathy, that parent-to-parent might be able to assist in this project, and then that might get people kind of thinking. Okay,
yeah, I'll start it out. And this is one of the things that I'm sure that I mentioned when I was at your conference. But one of the ways we have, as you know, trained support parents. They are just so important to this whole project that you're trying to do for one purpose, being the fact that we collect a lot of data on our support parents, and we know, their backgrounds, we know diagnoses, we know all of those things that they are willing to talk to another family on. So one of the things that I always see as being very meaningful is practices understanding what parent-to-parent does and knowing that they can refer patients to us. So as an example, if, and I know I've used this example too during your meeting, as an example, my niece, who was diagnosed with Moya-Moya syndrome, well, her daughter was, my great niece was, and at that time, she had no clue what that even was, no clue at all. Now, wouldn't it be wonderful if at that point in time, instead of her coming to me, instead of my niece coming to me asking me, Aunt Kathy, did you ever hear of this? And me, being who I am, knew to call parent-to-parent to Pennsylvania. And even though the doctors had already said that they might find 2 or 3 families in the entire nation who have this very rare genetic condition, it turns out that there were 3 families that were support parents in Pennsylvania alone. This is important information for us to have and to allow the doctors and the staff know that when they refer parents, many times parents can get that sense of it gets rid of a lot of the stressors that go along with us and our families as we are in those types of situations. So that's just one of the ways. I mean, I'd love to hear from some of you that are on the call right now that are able to talk, that are with parent-to-parent or that are a part of this call, whether you're with parent-to-parent or you were invited by someone from parent-to-parent, to see what some of your ideas might be.
Mary Summers has her hand raised. Feel free to speak at any time. Mary, your line is unmuted. Feel free to chime in at any point.
Can you hear? I'm not able to hear anything.
Hi, this is Mary.
I don't hear Mary. I'm assuming you're not talking to Mary Minetti. You're talking to the Mary that's on the line from parent-to-parent.
Yeah, I think she's coming through. Yeah.
Can you hear my voice now?
Oh,
yes.
You can, Mary.
Yes.
I am here. I just sent a quick chat remark and can pick up the phone. So in my experience, the trained volunteer support parents recognize the importance through their training in listening to the referred parents' concerns and then gently sharing their experiences in the specific area of conversation without imparting medical or technical advice or instruction. And that allows parents to hear from the practical side of managing medical care without giving medical advice. With parents, even if a parent is a trained physician or nurse or someone in the medical field, they're not in that role when they're in part of the parent-to-parent connection. And that's
Mary,
the importance of using volunteers that are trained.
So Mary, this is Mary Minetti, and I was wondering, when I think about patient activation, where we're trying to increase people's confidence and knowledge and skills, even though a peer mentor is not giving medical advice, do you think by talking with someone else who's had an experience that it can build some confidence in the new parent who's dealing with a new diagnosis, that they'll be able to manage because they see somebody who has managed already?
Absolutely. That's absolutely right. When you're looking at trying to climb Mount Everest and you've never put on hiking boots before, you have no idea what the walking stick is for or how to manage your oxygen as you go up that hill. You're really looking for someone that's going to help you along the way, and that's what the support parents can do for you because they have that experience of climbing the hill, of taking a child home with maybe with a trach and event, and help them to realize that G-tube fees is just a part of caring for their child's needs, not a way that they had anticipated prior to having that experience, but realizing that they can do it. So I think that the genuine experience of a parent who's been down that road, whether their experiences all have happy outcomes or not, can help a parent to reframe what they're seeing when they look up that mountain.
So, Parent to Parent has primarily provided support directly to parents that are like or similar to the parent mentor. I'm wondering, and Mary can comment on this, Kathy, others that are on the call. I'm wondering if there's a role for peer mentors in terms of helping through their storytelling the practices in understanding better how people develop health literacy, what practices do that assist them in growing their knowledge, skills, and confidence as a resource to expanding the knowledge, not just of parent to parent, but just of the experience that individuals go through when they're dealing with a significant medical condition.
This is Mary again, and in my experience, the practitioners can learn a great deal from listening to parents who've been through an experience. And we know as parents that our experiences will continue to grow and help us to grow as parents as well in our knowledge base and caring for our children. But when a provider asks a parent who's already been through a situation, so they're speaking to a volunteer support parent, for instance, and says, you know, we have this situation, we're trying to determine how to best manage, for instance, making sure that medications are taken on time, that doctors say that without realizing the context of, I want you to take your medicine on time. And so for a family, they can say, you know, it's great that you want us to give the meds at 8 and 2 and at 8, for instance, but look at the schedule that we live. Like, can we adjust that schedule to make sense for the child, to make sense for the family, and to therefore promote success in following the practice? I'll share with you, we just, in the hospital I'm working at, had a parent who happens to be a nurse by training and is caring for a medically fragile infant who's going to go home in a few weeks. So we have the practice of asking the families to come for a 24-hour stay where they basically provide all the cares. And they have the backup of staff right there in case they need help along the way, to be reminded of how to do something or to make sure that they feel confident in doing something. But they're actually providing that care. But when I went in on Monday morning, that parent had been in over the weekend for her 24-hour stay. And I said, how did it go? And she said, oh, it was really great. She said, it's a little tiring because you're like really up for 24 hours. You know, he sleeps great, but I'm like got my ear attuned for him to buzz or alarm or hiccup or anything. And I said, and how did you do that? And she said, it wasn't bad. She said, but when I get home, I'm fixing his medication schedule because this is crazy. It's not lined up with his fees. And I said, that's really good feedback for you to give to his practitioner. You don't have to wait till you go home to have that fixed. She happens to have the medical training that she knows she can adjust that, whereas to a parent who doesn't have any medical training, they might think there's some magical reason why they do the meds the way that they do it. But she, knowing the medications, knows that that's not necessarily true. It may be because it fits the nursing schedule better, but not necessarily making it easier for everybody. So, you know, that's where she can train our staff in a way that they hadn't thought about it before.
That's really a great example.
Parents really can help to shape the practice to be better, and again, to engage families in a way that will bring more success. Medications is a huge issue. I know that from experience. So,
and I noticed that Sherry's chatted in about the that newly diagnosed situations, it can be very isolating for families. And so part of helping connect people so that they don't feel so isolated can basically assist them in being able to ask questions and think through things that can help them prepare to be more active in their interactions with their docs and things.
I think just realizing that family engagement is a principle of your practice would be an important thing to tell families, that I want to hear from you. I want you to be my partner in this, that, you know, I get to see your child once a month or once a week or once every 5 hours if you're in the hospital, but that you're by the bedside, you're the person that mentors him or shepherds him through his day and his week and his month. I rely on you as my partner in this to be able to make sure that we maximize health outcomes as well as engagement in the community for the child and success in their life. So if practitioners could start to use that term when they talk to families, when they first meet them, whether it's new diagnosis or new to a practice or whatever, for them to say, I want to partner with you. I know that you're going to be the expert in the child. And I think docs have been a little bit remiss in not using that term. We've been saying it as parent leaders for a long time. The parent is the expert. But I don't hear that from the other side of the conversation. I think that would go a long way toward helping parents to become more engaged and also feel empowered to speak up when they see something not going right.
You know, and the comment that you just made, Mary, is an interesting one, because although that your mentoring expertise is parent to parent is based on condition and the commonality of that, it seems like, and I guess this would be a conversation, Kathy, that you would want to have with your parent to parent mentors, that there is, you know, not all practices in TCPI are pediatric practices, and it may be that there still is value in connecting a parent-to-parent mentor with a practice to share just what you were saying, Mary, about the importance of language and how that creates the invitation for families to be involved. Because, you know, children with complex needs are vulnerable in the healthcare system, but older individuals whose families are younger than them can be real assets if the practice is thinking beyond the model of it's just me and the patient, and really thinking about the importance of families. And I think sometimes there is a default that we assume if kids are young or have significant conditions that we want to engage with the parent. But I think that there's some learning that can happen not just in the pediatric world, but in the adult world as well, from the experiences that your mentors have.
And it's great you said that, because I'll say my mother is now 81 years old, and we've been dealing with some medical things in the last month and a half or so, and I find that she, first of all, is hostile towards me when I go with her to the doctors, because I say, well, I want to ask about this, and I want you to know about that. And she looks at me like, why are you doing that? You know, I said, this is what I do, Mom. When I know something that the doctor doesn't know about it yet, I share that information with them, because she can't do a good job for you if she doesn't know that about you. And, she, you know, she's just of the age where you don't do that, and always surprised to see me doing it, because I just feel really impassioned by the fact that as her daughter, my role is to make sure that they give her the best care they can. But she, as a patient, has never been invited to have a conversation about, so how's that medication working for you? They're just going to say, you're taking your medications? Is that list correct? Yes? Okay, let's move on. And no one ever says, so is that interacting with your digestion? Is it making you tired? Is it, you know, affecting other parts of your life? No one ever says those words to her. Ever, which at least in caring for my son, they asked me those questions. So I see a great difference in the way that children's, you know, I think pediatrics has been better shaped toward patient and family engagement, and definitely, perhaps because I'll one day be my mother's age, God willing, they'll have a whole different ball of wax in their hands. The shaping might be a little harder.
Yeah, hopefully they will, and as we coach them, as you help practices think more broadly. in the interest of time, because we have just 10 minutes left, the question that is really important that we will continue to have is, what support would you as mentors, parent-to-parent mentors, need from us, from TCPCC SAN, from myself with the Institute, to be effective in working directly with practices or PTNs? Because you have done great work working directly and connecting with parents who have similar conditions as you. But if we think about it being a little broader, in addition to letting practices know that you're available to connect with parents that have similar situations, but if we think more broadly on, some of the coaching to practices or sharing your story so that they understand how important language is or whatever, what support would you need to be effective in working directly with practices? Because we would work with Kathy so that you get that support. We want to, just like you got trained for parent to parent, we want to make sure that you are supported in being wildly successful as we collaborate with you to help benefit the practices that are out there trying to transform. Do people have thoughts on that right now, or do you need to think about it for a while and get back to us?
So one of the things that I'm thinking of that would be helpful as we compile a list is being introduced to staff, because in our database, not only do we do diagnoses, as you know, I mean, we are all ages. So our support parents have children that are of all ages. They are pre-birth through age, through death. And because we collect so many data elements about families, it would be, in my opinion, one option might be to let hospitals know or connect them to the trained support parents that we have that are within their area, and maybe invite them in to talk, because we can find out on location. It doesn't have to have anything to do with diagnosis, but it can be location, maybe have some sort of a gathering so that staff can get to meet families in the area and discuss these topics and things like that. That's just one thing that's off the top of my head. And the other thing is relating to the transition. This is a little bit different. This isn't answering your question 100%, but I do want to, I think it's like a piggyback off of what Mary had said earlier, is transition to home. So when a patient ends up going home, do they have the support at home? Because that's a whole lot different than when you're in the hospital and you feel kind of secure because there are medical people nearby should something happen. But I don't know whether Heather McInnes is on this call. I know she had signed up to be on it. But as an example, is NICU families, when they come home and their children are still having bradycardias and they're coming home with all of these all this equipment, and the alarms are going off through the night, that's really a scary situation. So I think having medical personnel know the importance of the transition to home so that they can link them up with a family who could be there for them after the hospital visit is hugely important, because it's a very fearful time.
Well, and I think that that's a really good point, because the TCPI project really is focused on not the acute hospital stay, but on providing support and engaging patients and families in outpatient care that may be related to the hospital, because you go into a clinic in the hospital, but you're not, in a bed staying, and in primary care and specialty care out in the community. And so often if you don't have the support in that transition, once you're in the community, that community support, people end up back in the hospital, which increases costs and reduces or creates all kinds of stress and those kinds of things. So one of the things that I, in the interest of time, would just ask all of you on the line, and those of you that may be listening into this webinar, is to think about what kind of support you'd need in addition to what Kathy's shared, which is introductions and opportunities to share information with practices and tell stories and make recommendations and those kinds of things. So I think that that's important. I want to bring to your attention unless somebody has something that they want to say really quickly related to this question.
Sherry Santa wanted to chime in for a second.
Thanks.
Please do.
This is Sherry Santa at Texas Parent to Parent, and I'm our medical education program coordinator. And I know we're not the only P2P that has a med program, but I think supporting programs like that, like ours and other states with them, is a great way to help brand new healthcare providers understand some of this on a very personal level. We offer things like parent interviews where they get to spend time with them. We have where they can come into a family's home, spend time learning about what is life really like outside of that 15 minutes in the exam room. And we work with all kinds of different healthcare providers, and I think it's a great way to start kind of changing the dialogue very early in their careers and learning from our perspective. I'm not just saying that because I love our program, but I think that all the med programs around with the P2Ps will probably chime in and say the same as me, but thank you.
Great. Thank you for sharing, Sherry. Other comments? Were there other hands raised? I can't see hands raised, Jacinta, so I rely on you on that, in that regard.
I think Sherry was our last one, yeah.
Okay, great. So what I want to do is shift so that we can wrap up, but the conversation is not over. That's what I really need you to understand, and so I want you to continue to think about these two questions, and I'm assuming, Jacinta, people will be able to get copies of the slides. I want to share with you some resources that could help you a little more get kind of grounded in what TCPI is about, and some materials that we've developed. One of the things that PCPCC Santa is going to be working on is this Choosing Wisely campaign, and you might become, I encourage you to go out and look at Choosing Wisely. It really is around reducing unnecessary testing and helping people make informed decisions based on evidence and also their values. And so as you think about the role of parent to parent, there may be some opportunity for you to provide some guidance as organizations and practices go to implement Choosing Wisely. And and so this is the website where you can get some information. And there's information for practices, but there's also information for patients and families. And so there may be some opportunity there as well. And then over the years, the couple years that we've been doing this project, we've created some, there's more information on the metrics, and that's great, but we've created some toolkits. One is how to be an effective patient and family advisor, which is for practices as they're getting ready to launch advisory programs. And then the other thing is this resource on 6 steps to creating a culture of person and family engagement in healthcare, and it's activities that can be done at the practice level with practices as they think about it. And I was thinking, Sherry, about your comment about medical education and sharing stories with practices and things. And I think about how important in outpatient teams are, not just the provider, and how powerful doing panels for staff and education so that they can understand what the lived experience is like. And so those are some potential tools just to be aware that are out there, because there may be some tools that parent to parent can create as well for the TCPI practices. In terms of next steps, I'm going to be talking with the TCPI leadership on Friday about this interest and facilitation that we're going to do to help connect parent to parent with practices in the TCPI project and get ideas from them about what are some ways that they think that might work well and what would it take and those kinds of things, so that we can feed that back to you and to Kathy so that we can continue this dialogue. As you think about the questions and as you review some materials and as you think about those metrics, activation, how can you help with medication management, how can you help providers and teams understand how important shared decision making is in that process, and what might they need to be paying attention to as it relates to health literacy and people trying to make sense of the healthcare system as they're trying to grapple with new diagnoses. Please send your ideas and your thoughts to Kathy, and I know that you know how to get a hold of Kathy, and then to Marilyn and Jacinta. It was an oversight that my email is not on that list, because I'd love to see your ideas, and I'll continue to work with you and Kathy and Marilyn and Jacinta on this. But that was my oversight in putting these slides together. So please stay in contact with us. We're going to continue this conversation. We're looking forward to those of parent-to-parent members who haven't been able to participate in today's conversation, to review this and to begin to think about how we can form a partnership that's really going to help transform healthcare. I encourage those of you that are leaders in your state potentially to begin to have some conversations with some of your on-the-ground parents as well, to see what ideas that they might have, so that we can kind of gather those ideas together in the next month or so, so that potentially at the first of the year we'll be prepared and ready to really kind of, market's not the right word, but to offer the services that you have available to the PTNs and the practices, and create that really strong partnership. Marilyn and Kathy, do you have anything else to say? I know we're 1 minute over.
Right. Well, I just wanted to thank everybody for joining us, and I will be Jacinta and I will be sending out a survey, a feedback form within the next 24 hours, just to get your ideas on what worked and what else you would like to see, and just your opinion on the whole session. But thank you very much.
Yes, thank you so much. And we will be back in touch, and I'll do a follow-up on this call and tell you about next steps as we discuss them.
Great. Thanks, everybody, and have a great rest of your day, and enjoy Halloween.